That's what matters.
Yeah.
We're going to start, guys.
Shoot. Okay.
Okay, so
We'll go off camera, Tracy.
go off camera and mute. Hello, everybody. Sorry that we're starting just a couple of minutes late. This beautiful technical world that we're living in. We just had some problems with connection, so sorry about that. My name is Tracy Curtis, and we would like to welcome you here to almost 2 years of helping you find your COVID balance with the help of Marva and Anne-Marie and Helen and our various guests, and we have a very special one today. So thank you so much for joining us. I'm going to have just a little bit of a different type of a land acknowledgement to start our time together tonight. I felt when I read this that this needed to be shared. There's so much unrest, and so hopefully that this grounds all of us tonight. So this is called the Great Spirit Prayer. O Great Spirit, whose voice I hear in the winds and whose breath gives life to all the world, hear me. I need your strength and wisdom. Let me walk in beauty and make my eyes ever hold the red and purple sunset. Make my hands respect the things that you have made and my ears sharp to the hear of your voice. Make me wise so that I may understand the things that have been taught by my people. Let me learn the lessons you have hidden in every leaf and rock. Help me remain calm and strong in the face of all that comes towards me. Help me find compassion without empathy overwhelming me. I seek strength, not to be greater than my brother, not to fight my greatest enemy, myself. Make me always ready to come to you with clean hands and straight eyes, so that when life fades as a fading sunset, my spirit may come to you without shame. So that was written by Lakota Chief Yellow Lark in 1887. So I have the pleasure to, first of all, introduce you to Marva Wisdom, my dear, dear friend, Marva Wisdom. Marva is a senior fellow at the Monk School of Global Affairs and Public Policy at U of T, with a focus on equity, inclusion, women's studies. She is also a fellow of the Environment Institute of the Survey Research. As a senior equity practitioner, her service delivery is to local, national, and international clients, including as a keynote speaker, moderator, coach, advisor, researcher, and writer. Marva is honored to direct this year's Music-Geddes Foundation annual International Arts Everywhere Festival. And this Friday, their flagship program, the Guelph Lecture on Being, is taking place live at the River Run. So please make sure you look that up online. Again, if you look up Arts Everywhere Festival by the Music-Geddes Foundation, you'll find it there, and there you can get your tickets. But it's incredible speakers. And so thank you, Marva, for being part of that organizing community there. So Marva, I'll take it over to you.
Let me take myself on camera. I am on camera now. Yes.
There you go. We see you. Great.
Hello, everyone. This is really quite wonderful to be here with you again. It's been a little while, and it is my great pleasure to be a part of this. Thank you, Tracy, who's always doing some great work. And Tracy really is one of the folks that got us started. Is it 2 years now? I can't, it's June coming up. It will be, yes, it will be 2 years since she initiated having a conversation with our community between her and Helen around finding the COVID balance. And so we thank you for that. Thank you for that vision for our community. And so each month, I think we decided to miss April because there was just so much going on and there was so much uncertainty. And we also wanted to make sure that we had one of our very special guests, Dr. Matthew Tenenbaum, that he would be available to be with us. And so Anne-Marie and Helen with answers your questions about mental health, again, with our special guest, and talks about the physical implications and the mental implications of the COVID-19 pandemic. I mentioned Dr. Tenenbaum, that is the Associate Medical Officer of Health, that will be joining us tonight. And he, of course, is with the Guelph Wellington Dufferin Public Health Unit. And we welcome him and appreciate that he is here. We just chatting that he's got a 13-month-old, I think it is. He'll correct me when he comes on. So he's very busy with his baby girl and his family, and we appreciate that he's taking the evening to be with us. This week, as many of you know, is Mental Health Week, and the theme is empathy. Empathy is the ability to understand another's perspective and feelings, and for us to get involved so that we can show each other the empathy that we need to get through this pandemic. To learn more about mental health and empathy, we ask you to go to www.mentalhealthweek.ca. I don't think anybody says www anymore. They just say mentalhealthweek.ca. So forget that I said that part. We want you to share your support on social media by downloading a toolkit and using the hashtags #GetReal and #MentalHealthWeek. Or you can also donate to support CMHA mental health programs and services at cmhaww.ca and click donate, or participate in the upcoming Shoppers Run for Women in support of CMHA. We are involved in that. Yes, we have signed up. We have a team going in, and we are looking forward to that. And of course, the CMHA Waterloo Wellington. Connect. If you or someone you love is struggling, please call here 24/7. That's here 24/7. And locally, CMHA Waterloo Wellington is offering a number of webinars this week. Visit the website again so that you can see these webinars and you can participate, help to strengthen your own mental health and help someone around you. So let me now go and introduce our wonderful panelists. That it gives me this great big smile when I talk about them and this whole group in bringing this to you. Anne-Marie Zadlik is a primary care physician in Guelph. And I have to tell you, she's not feeling terribly well tonight, but she sees this as critical and important. So she has made it and she is here. And we hope that she'll have the strength to get through for the rest of the program for the next hour. She provides comfort and guidance to thousands during the pandemic. Her Facebook page is quite huge. It is a sensation. Lots of people go there to find that comfort, to get information. With her daily posts of encouragement and her sound scientific knowledge about COVID-19 and other health issues, it is quite a service to our community and way beyond that. And our other partner, Helen Fishburn, is the CEO of the Canadian Mental Health Association of Waterloo Wellington, and you heard me share a bit about that. Helen is a lifelong advocate for increased awareness of mental health issues, and she has dedicated her career to advancing the design of an improved mental health care system. We appreciate having her. We appreciate her guidance, and when she speaks to you about mental health, for me, she's the epitome of empathy as we talk about empathy, the theme of mental health awareness for this week. Now, Dr. Matthew Tenenbaum, I shared a little bit about him. He'll probably tell you a little bit more, but prior to joining public health, Dr. Tenenbaum worked for several years as a family physician in Hamilton. He completed his residency in public health and preventative medicine at McMaster University, and during which he spent time at several health units in Southern Ontario, including Wellington Dufferin Guelph Public Health. We are really happy to have him in our community to help navigate this uncertain time around COVID-19. And I'm going to ask each of them, Anne-Marie first, and then Helen, and then Matthew, to start us off with opening remarks right after I give you some housekeeping rules. So tonight, you may be joining us either on Zoom webinar link or via Facebook Live broadcast. We want to answer your questions. We'll answer as many questions as possible. We're asking you to feel free to type your questions in the Q&A section of either Zoom or Facebook, and we will try to answer all of them. If we don't answer them live, we will put the answers up later on. Give us about 48 hours or so to get to them. We are recording this webinar and it will be posted on the CMHA Waterloo Wellington site. And of course, it will also be on Dr. Zajdlik's Facebook page after the webinar is over. So over to you, Helen, Matthew, and Anne-Marie, starting with you.
Starting with me, can you guys see me? Or hear me?
We can hear you very clearly. We can't see you, but you'll probably come up later.
There.
There you are.
So I'm on my cell phone, my computer, I don't know what it's doing. I did an upgrade recently and it kind of dismantled everything the way I know it on my computer, which drives me crazy. This is great timing for our webinar tonight because it is Mental Health Week. And I know that personally I've been struggling since February 24th when Russia invaded Ukraine, and it seemed to be an extra terrible layer of stress that has come upon all of us. And I don't think any of us have lived with this much community global stress ever. So I am worried about the state of mind of everyone. Even though I think we're settling into a steady state when it comes to COVID, and we are, and hopefully we'll talk more about that tonight, these are really, really difficult times. And I'm fearful that many people are kind of cocooning in and not even bothering to really try much anymore. And if you're one of those folks, please reach out. And I think we need each other more now than ever, and we need to take care of each other's mental health more than ever. I'll just put a plug into my profession and to frontline workers, because I am gravely concerned about the state of well-being of physicians and nurses in our hospitals. The healthcare system has essentially disintegrated, and we don't have a government, no offense, that is really paying too much attention to it right now, but we are in absolute crisis mode. I'm feeling the extra stress of that. I know that we all are, and there is a sense of helplessness that a lot of us feel. So I just want to draw attention to that group of workers who have been working so diligently for over 2 years and now are suffering the long-term effects of a healthcare system that's no longer intact. Not to scare anyone, but it's no longer intact.
Thank you, Anne-Marie. We can move over to Matthew.
Hi, everyone. Good evening, and thanks for having me on with the panel this evening. Just building off of what Anne-Marie was sharing, certainly the past couple of years have really been an incredibly challenging time. And even though we are at a place where things are becoming a bit more stable and we are moving into a different phase of the pandemic, we come into that phase with all the accumulated experience that we've had, where we've had such dramatic changes to our lives that have really impacted our mental health and impacted the way we interact with one another. And as we move forward to the next phase of this pandemic, we're going to be practicing those things that we know are important. We're going to be getting our vaccines. We're going to be wearing our masks. We're going to be, watching out for those higher risk scenarios and taking precautions appropriately. But we also need to do those things alongside reaching out to those around us and rebuilding some of those connections that may not have been as strong during the pandemic, and connecting with people who are important to us and those around us. I know that the theme of Mental Health Week this week is empathy and the ability to understand the perspectives and feelings of those around you. And I will just say that as we enter this next phase as a community together, it is really important to build on that empathy that's always been there. Look out for one another, think about the needs of those around us, and recognize that the circumstances of those around us are going to be different than perhaps our own circumstances. People are going to have different challenges in the weeks ahead. They're going to have different levels of readiness to move into the next phase of the pandemic. And the more that we can all be mindful of and practice empathy and really think about doing the right thing for those around us, the better off we're all going to be, the safer we're going to be, and the better our community's mental health is going to be as we move forward from this point. So thanks again for having me, and looking forward to taking your questions later.
Thank you, Matthew. Thank you for being here. Helen?
Yeah, thanks so much. I couldn't agree more with my colleagues, and it really is amazing timing that we are gathering here during Mental Health Week. As we shift from a pandemic to an endemic, and we are shifting. It's a slow, gradual shift, and there'll continue to be waves and continue to be things that we experience. But the wake of what's been left is really the mental health toll. And when you think about a cup, when you continue to pour water into a cup, it can't take any more water. It just literally overflows. And it really feels like that's where we're at with our mental health. Everyone is exhausted, worn out. Their cups are completely full. And that's actually why we see people not being able to have empathy, why we see some of those divisions that are so intense and difficult in our community, because we're not able to understand where each other's at. We're all not able to step into each other's shoes and share perspectives. We are so consumed by our own feelings and our own exhaustion that it is really, really hard to do that. And there's no judgment around that. We can't just snap out of it. We can't just flip a switch. And now that things are a little bit different and we're starting to, not have as many restrictions and being able to move around in our community and travel a bit and do all the things that we've been looking forward to, we have to remember that we are carrying the cumulative toll of this past 2 years. So there are things that we can do to increase our empathy. We'll talk about that tonight, but it really is a skill. It's something that can be taught and something that can be practiced. And the more empathy we have, as my colleagues have said, the more we're going to be able to get through these divisions, come together and heal, and really support each other, because really that's ultimately what we all need as part of our mental health strategy. Back to you, Marva.
Thank you, Helen. I'm going to walk away feeling cup full to overflowing. You can even feel that, eh? It's something that you can totally visualize. And I'm going to get to the questions, and I have a question to start off. Have you found that the expectation in the fall, that by January, February, March, May, by this time of year, that we will have gotten past the major part of the pandemic? And of course, then we had the Omicron and we have the pandemic continuing still. Have you found that that has exacerbated people's mental health with the expectation that we're going to be out of it and then suddenly we're back into it?
Absolutely. So Omicron probably was the biggest disaster to our mental health. We didn't expect it. It hit us hard. It hit us just before Christmas. And it also changed the rules of the game. We had to, there were different testing requirements, different masking requirements. It was transmitted differently. And it was probably one of the most challenging waves that we experienced in COVID at a time we were the most exhausted. So it absolutely was very, very damaging and also very exhausting. And really concerning. It was so transmissible as well, and people were becoming so ill so quickly. Psychologically, we weren't prepared, and physically, we weren't prepared. Now, we got through it as a community. We pulled together. We turned on a dime. We put new testing guidelines, new quarantining. We did so much in a very short period of time, and that's what our community does. But of course, around that time, we also saw the freedom convoys and many protests, which brought a lot of anger out. A lot of those dark feelings that we've been holding on to came right to the surface. So it has been a really, really tough time. There's a lot of feelings and a lot of hurt and pain and suffering that people have been holding on to, that is still there, that people are still working through. But absolutely, Marva, the past couple of months have been really, really tough.
Thank you. And Matthew, your colleagues and what your experience has been with public health. Certainly public health has been front and center, a lot of information, a lot of communication. Another part of this that I have seen and heard from others, there wasn't as much communication just across the board coming out as they had expected to see because of the way Omicron hit. What have you found with public health with this new wave?
I think that one of the challenges with this new wave and with Omicron is that the way we responded to it was quite different than the way we responded to the previous variants because we had to shift our approach. Back when we had, Delta and previous variants, we had certain processes and approaches we could take in public health, and as a whole system, that made sense. And when Omicron hit the scene, it was just so transmissible that some of those systems around testing, for example, had to change in order for us to adapt and manage it in a way that made sense. And I know that we talked a lot in December and January about how to make that pivot and how to think about Omicron and think about this new wave differently. We've also been increasingly emphasizing the fact that those basic things we have been doing, they still work. So things like wearing a mask in indoor or crowded settings, still very important. Getting all your vaccine doses, still very important. Staying home if you're sick, still very important. But those basic things are still the foundation of what all of us can do, whether we're managing Delta or Omicron or any variant. Those things still matter. And so our communication has focused a lot on building on that shared understanding that we all have now 2 years in, because those fundamentals about what we can all do haven't really changed very much.
Thanks, Matthew. And Marie, I don't know whether you want to answer this question as well, or I can move on to one of the other questions in terms of your colleagues as a primary care physician on the front line.
Oh, I think it's totally different from the way it was in previous waves. I agree with Matt that we had to pivot and change our approach to it because Omicron was so transmissible. I have seen many more patients in the office, talked to many more people on the phone every week. More and more people have Omicron, and I think we now all know so many people who have Omicron, who have had Omicron, had COVID-19. The promising or the hopeful thing is that by far in most people, it's a mild illness. And I've only needed to see 2 or 3 in the office to check them out. These are people that have had rapid antigen tests that are positive. They have not needed to present to the COVID assessment center for a PCR test. They have not needed to think about getting Paxlovid, the antiviral, because it's all mild symptoms. It's going through families very quickly, but it is maybe more transmissible. But my impression, and I think this is backed up by research, is that it is just not causing the same disease burden, the same amount of serious illness, or the same number of admissions to hospital. Our healthcare system was not poised to handle another surge, and I think the healthcare system is struggling. But for the most part, I think what we are seeing now is what we're going to be dealing with over the next year or so, and that is cold symptoms caused by COVID, and hopefully an annual vaccine that keeps us out of the hospital, and learning to live with COVID as time goes on. And I think we are totally able to do that.
Thank you. Thank you for that. And that sort of set the stage as we go forward and how we deal, how we interact with each other. Kat has a question. I'm going to shorten Kat's question. And this is just going to go out there to whomever wants to jump in and answer it. Kat says that I'm very concerned with the developing story of hepatitis in children. And I'm going to skip some parts that she's put here, but she says, I'm triple vaxxed, as is the other adults in my household. We got COVID a few weeks ago, mild for us, but annoying as it lasts almost 2 weeks, as you were mentioning, Anne-Marie. My 2-year-old also had it, and now I'm worried about her developing hepatitis. She had vomiting and fever, and I did take her to Emerge to help me get the fever down. It broke after 3 days. I feel like there is no win. Disease if you get real COVID, disease if you get the shot and simulate it. Should I be worried now since she got COVID? When the under 5 shot comes out, should I not get her the vaccine, since it appears to me that reintroducing it can cause worse damage? And then she sends a whole bunch of different links. But I'm going to suggest that the 2 questions, should I be worried? And should she cause worse damage by getting the shot for under 5?
Matt, I'll start with the first part of that question. And I'm not sure we can completely answer questions about the immunization for kids under 5 yet, because it hasn't been approved for use by Health Canada. So a lot of the research coming out of Moderna and the research trial information is not necessarily public or known to all of us quite yet, but more details to follow on that. I believe from the research I've done that the cases of hepatitis are extremely, extremely rare. And there is some question as to whether they were actually caused by COVID-19 or were they caused by adenovirus. And it's important to note that adenovirus is a common cold virus, although several viruses cause colds. It's important to note that viruses we've had up until now that infect many, many people that have just mild symptoms can also cause serious symptoms, although rarely in every age group. And with the flu virus in particular, it can cause very serious illness in both old and young. And associated with those serious illnesses are complications that include hepatitis. So I'm not really sure that we should be focusing too much on the news coverage of the hepatitis. I think it's a very, very small, tiny, tiny percentage, and it may not necessarily be just COVID. And we have been dealing with complications like that from viruses for many years. COVID is not new in that respect.
Just to build on what Anne-Marie shared, so this question around adenovirus and hepatitis in children, that's a really new issue that's emerged, and there's a lot of scientific work going on right now to really understand what is happening here, what could be causing this, because right now scientists don't really know everything they want to know about what's been happening. And one of the reasons this has hit the news and drawn so much attention is because there hasn't been an explanation for why these children have gotten hepatitis. And some of them have gotten quite severe illness, but we can't really explain why. And there's a lot of investigation to see what could be causing it. Could it be a virus like adenovirus or COVID-19 virus? Could it be some other non-virus, non-infectious cause? We don't really know yet, and we're in the very, very early days. So I don't want to jump to conclusions, except to say that this is still being looked at, and we're quite concerned about public health, and we want to know what's causing this so we can take appropriate actions as appropriate for our health unit. What we're not worried about, though, is the vaccines. We're not seeing that as a contributing cause. There isn't any data to suggest that's what's driving this. And in fact, we've seen from the vaccines we have available that they're quite safe, and we don't really have reason to believe they could cause hepatitis. As Anne-Marie mentioned, we do have this vaccine for under 5 that was submitted to Health Canada last week. We're going to be watching very closely to see when that shot gets approved, if it does. And if it does, I can tell you that I'll be making an appointment for my daughter as soon as it's available for her.
Thank you. There was a question from John, which is related to this about the vaccine and shots. So I'm going to flip it back to you, Matthew. They said, I have heard mixed messages of how many weeks you should ideally wait between shots. I have an almost 5-year-old who will be eligible at the end of May. How many weeks should we wait for the second shot?
The short answer to that is the best period of time is 8 weeks. If you're going to take one thing away, right now it's 8 weeks. And the reason that this is a bit of a complicated question is because when Pfizer and Moderna did their studies on the vaccine, they used either a 3 or 4 week interval. And so that would ordinarily be our default go-to number of weeks to wait. However, we learned during the pandemic that actually, if you space it out more, you actually get a bit of a better immune response. And we had the experience during our first vaccine rollout when we delayed second doses. And we learned from that delaying a second dose does make sense. Our experts say that 8 weeks is the length of time you should delay it to. So the best time is to get dose 1, then 8 weeks later, get dose 2. You can get it shorter than that at 3 or 4 weeks, but if you're trying to optimize the vaccine benefit, 8 weeks is the way to go.
Thank you. That's great. I am sure that John appreciates that response. And Helen, Mental Health Week, and we know people's mental health is suffering. And you have given some great advice as how people can deal with their mental health, especially now through the pandemic. And I'm sure that you have experienced and have seen all kinds of different shifts and changes and strategies that people are using. How can we deal with the challenges we are facing right now and support others as well?
Yeah, it's a really important question, just because it's been such a long and painful journey over the past 2 years. So I think the first thing it's important to recognize is what normal looks like. Uh, Honestly, our life will never look the same as it did prior to the pandemic. There's been too much change. Our world has changed, our experience has changed, we've had losses, we've had successes, there's been all kinds of things that's changed our world. And the most important thing that I think all of us can do right now is just give ourselves time to heal at our own pace. And that looks very different for everyone. If there's losses that people have experienced, it's really important to have time to heal that and to bring some closure. I think there are a couple of things that people can do, practically speaking, too. First is to know that you're not alone in your mental health. The pandemic has affected every single one of us. Others appear, it might seem like they're getting back to normal around you. However, everyone heals at their own pace, and appearances can be deceiving. So don't compare. Really just look at yourself. Know it's not a race, and just know that you're not alone in that journey of yours. Also think about what you want your life to look like moving forward. Many people have talked about the pandemic helping them think about what they want in their life, and what society expects versus what society expects from us. This is really an opportunity to get perspective, to figure out what you want in life. The pandemic has taught us all how precious life is. And it really gives us an opportunity to think and reflect and take control over what we want into the future. And I think certainly practicing mindfulness and just continuing to keep yourself grounded is so important. Having gratitude, having perspective about, life's issues, certainly building that empathy so that we're understanding and listening to each other, and moving away from some of that divisiveness. All of that takes time and practice and skill, and is really important. I think just the last thing I would suggest, it's so important to think about when it's time to ask for help. We all kind of navigate our mental wellness on our own as much as we possibly can. But if things aren't working, if you're not feeling that relief, if you're not feeling better, if you're not feeling yourself, it really is time to ask for help, whether that's your family doctor, a private therapist, calling us at Here 24/7. There are so many options. Please just don't sit in that silence and suffer. You don't need to. And I always think about this: if you have a toothache that isn't going away, you would call your dentist. So take the same approach with your mental health. Reach out. There are so many supports that are available, and we can connect you to that care.
Thank you, Helen. Thank you so much. I'm just looking at a question in the chat, and we're going to get to that in a moment. But this is for Matthew, and it has to do with wastewater. I figured that you might be best positioned to answer that. Anne-Marie won't mind. We're not going to burden Anne-Marie too much tonight. We're lightening things up a little bit. Not only that, but she has fun listening and watching Matthew answer the physical health questions. This person says, I haven't heard anything on wastewater numbers since before Easter. Could you tell me if the numbers are still around 100,000 cases a day? Hopefully they've gotten down. Could you tell us the estimation per day now, please, if you have that information, Matthew, of course.
Thanks, Marvin. This is a real question, because ever since our testing changed as a consequence of Omicron, the ability of us to know how many cases there are is really different now. Even before, when we had testing, we knew we weren't getting every single case counted, but now with much less testing, we know we're missing more of the cases than we ever have in the past. And I know that earlier on during this wave, Dr. Uni from the science table talked about there could be 100,000 new cases per day. And of course, people might want to know, how is that? What's the number now, if there's a number we can pin our hopes on? I think from my understanding, having done a bit of reading on wastewater testing and understanding this fairly new way of measuring COVID in our community, it does seem like, from everything I'm reading, that it is very difficult to pin down a number based upon a wastewater signal. There's so many variables that go into the strength of a wastewater signal that we measure. And while I, fully believe Dr. Uni has the expertise to try to pull a number out of that, I can tell you that I don't, and I don't know if I could give you a number with confidence, whether it's for our community or for the province, as far as how many cases per day, except to say that it's certainly more than we've had at earlier points in the pandemic, except for perhaps the wave we had in December and January. What I will say in terms of the overall trends is we have data on our website, wdgpublichealth.ca, that shows our wastewater signals in Guelph and Orangeville, where we measure them. And as well, if you go to the website of the Ontario Science Table, you can see the provincial wastewater signal and the regional breakdown of that number. And if you look at that data, what it does seem to show right now is that while the signal is fairly high still, it has stabilized and plateaued. And that aligns with what we've been expecting to see. And so it's not going up and up and up like it used to. It is stabilizing, but the number is still high. And so even though we don't know exactly how many new cases there are per day, we do know COVID is still out there, and it is as important as ever for us to practice those basic measures, like physical distancing, staying home when you're sick, etc., and of course, getting our vaccine doses.
Thank you, Matthew. Lots of information. We didn't give a number, but lots of information, and I think that's important that people have that. I think that's part of why we love having you here. You just tell it like it is. Thank you. Emery, this person would like to start traveling again, but is nervous to go on a plane. Do you feel it's safe even when this variant is so easily transmitted? Also, is it safe to be in a busy airport while the numbers are so high? I have to say, I have been in a busy airport a couple of times in the last 3 months. Knock on wood, no COVID, but lots of masking and distancing where we can.
I'll answer that question yes and yes. So people might be surprised by that, but I do think it's safe to be in an airport. Wear a good mask. I would recommend an N95 mask if you can, instead of just a KN95 mask. So there is a difference between the two. The N95 mask fits more like a suction cup, and it is much less likely for Omicron to get into any gaps if there are no gaps. So wear a mask that is tight fitting with no gaps. I think airplanes are a very safe place to be because of their filtration systems. I don't agree with taking masks off on the plane, but even if other folks do, keep yours on, and with your full vaccination status. And I will say that I think that needs to be 3 in order to travel, not 2 vaccines. Get 3, and if you're ready for your 4th, if you're eligible for your 4th, get that as well. Once you have 3 or 4 vaccines and you wear a good quality mask, travel. I did in March, and man, was it nice, so nice to get away. I kept a mask on. I have 3 vaccines, not eligible yet for a 4th, but I felt very safe. I didn't like some of the behaviors I saw, but I still felt very safe.
Great, and I'm going to follow up with you still, Anne-Marie. You had mentioned in your opening about healthcare workers and what they're going through, and this question is asking for some advice. What are your thoughts about how we can help our healthcare worker hearing of the results of the long-term stress of COVID-19?
Well, there's an election coming up, and I will not recommend who people should vote for, obviously, but we do have to look at all of the parties' platforms. And I haven't looked at them yet. I'm going to do that this weekend. But if the party you're looking at has no platform for improving our healthcare system, for assisting the existing system, for assisting those individuals that work in long-term care, emergency rooms, ICUs, primary care, if they have no plan to try to make this system recover, I really question, because without a healthcare system, it absolutely terrifies me. There is talk now across the country about millions of people not having access to primary care. If you don't have access to primary care, and you are entitled to that in this country with a healthcare system that should be free and universal, you are at risk of developing illnesses prematurely, of developing illnesses that could be prevented, and of not having illnesses treated. So I think that's the best way you can help. It's a massive problem, and it can't really be tackled by one person, but we can really make sure that we're pushing our elected officials, our MPPs, analyzing platforms so that we can not overlook healthcare, or I guarantee we will lose access for most people to consistent healthcare.
Just to build on that, Marv, I totally agree, Anne-Marie, and I think we do have a great window of opportunity with both the provincial and the municipal election coming up this fall. We've actually put a campaign together called I Choose Mental Health and Addictions, and it's about informing our community about the gaps in mental health and addictions care, both for the people that are seeking care and need that care, but also for service providers like CMHA and others who cannot meet the operational requirements of actually running a business because of the chronic underfunding. And that is part of the challenges with our staff being so exhausted and so stretched because we don't have enough funding, we don't have enough staff, and we have not been able to keep up with cost of living increases, rent increases. All of those factors are if we were a business, we would be bankrupt, right? So we have to really have our community speak loudly about prioritizing healthcare and specifically mental health and addictions care within that, so that we can protect the wellness of our community, both the people that need the care and the people that are providing the care. And all of us have a voice with both our elected officials as well as people that are running for office. If we use that voice, it adds a lot of power to that platform. So really, this is a window of opportunity for the next 30 days.
Can I add to as well, Helen, just to say that most family doctors are running a business. We have hired staff in rent space, and good, bad, or ugly, we received a 1% raise this year, which doesn't even begin to cover previous costs or to cover cost of living.
Yeah.
And in British Columbia, CBC article this week sometime, there are 900,000 people without family doctors because physicians who are choosing their specialties are not choosing family medicine nearly as much. And those that do graduate do not want to take the risk of establishing a practice in the community when they aren't guaranteed an income that will allow them to cover their overhead expenses. I know that for the first time ever, I am afraid of my ability to continue on, even though I have no intention of retiring, in the present climate where it's been so easy to neglect nurses and physicians for decades now. That has to stop. It's not reasonable at all. It's unfair. It's too easy for governments to do that. And only the voting public can change that by insisting that we take care of our healthcare workers.
I find this conversation and the responses very, very interesting, because for the longest time, we've always been told to not talk about the importance of representation, the importance of public policy as related to those who make legislation. And I'm from the side of, political science and policy. That's the hat that I wear. So when I hear somebody else talking about the importance of all of us and the difference that we can make, I always remind people that we are the government. The government representatives are there as representative. They represent us because we are telling them what we would like them to do, and we have voted them in for that reason. So when we hold our hand up and people say, oh, I don't want to talk about anything to do with government, or I don't want to talk about policy or small p politics, this is not about partisan politics. It is about how we speak for each other, our interconnectedness. If we don't have primary health care, if we don't have mental health, if we don't have public health, if it's not adequate, then it's impacting all of us. And at the end of the day, when we all fall down, or when a portion of our community falls down, all of us fall down. And so we are the government, and that is a reminder, and it's great to hear that coming from yourselves. People always say, oh, let's not talk about that, but we've realized now how important that is.
We have.
So let's move to Helen. Let's continue with you with this question. My son is resistant to having a booster. After I approached him about this, he has declined to communicate with me. How can I repair our relationship? Not an easy question, right? Just an easy
No.
one. You can answer that. Very easy.
It's not easy, and sadly, it's far too familiar. Again, we're seeing those divisions. We're seeing that there is just such a intense disagreement between people. And even if it's not, a highly conflictual thing, people just completely avoid, withdraw. And in many cases, the relationships have been broken over it. So again, you coming from a place of empathy, which is our theme for Mental Health Week, we want people to understand. We want, walk a mile in your son's shoes, do your best to understand those fears and what his concerns might be. There does come a time and place where you can't change someone's opinion, sadly. And you are at risk of losing that relationship. So you really need to back off from the conflict and hold that space, hold that tension, hold the relationship so it doesn't break. When you think about it, there's a glass ball that you're holding and you can't drop that ball because it will shatter. So do your very best to protect that ball, to hold it, to be very careful and very fragile and be very supportive. Your son is feeling that way for any number of reasons. And the more you can empathize and understand and take his perspective while still holding that relationship is so important. And eventually that may change and he may change his mind. If he doesn't, though, you need to continue. He'll always be your son, right? So you need to continue to build that bridge.
So Helen, now in my one hand, I have a cup overflowing. And in the other hand, I'm holding a glass ball. both I have to be careful with on other side. So the visual.
And that is actually the complicated landscape that we're in right now. It feels, honestly, I'll add another analogy because I'm the analogy queen at work. It's like walking through a minefield sometimes, right? And it's very, very hard right now. There is a lot of pain. There is a lot of division. There is a lot of misinformation. There is a lot of fear. And everybody internalizes that and holds on to that very differently. So it is a complicated world we're living in. That's why the most amount of love and support and empathy and compassion we can afford each other, that's really our ticket through that minefield. Mm-hmm. But it's not neat and it is not tidy.
No. Thank you. Matthew, I'm fully vaccinated and boosted once, and that's true of me too. Does the vaccine protect me against long COVID? And does it protect even as my booster is becoming less effective while I wait for my next booster, which I'm due for now, but I'm not the right age? And in addition to that, I will ask from Facebook, how long after having COVID do I get vaccine number 4? So 2 questions in there.
Sure, I'll try and work them both into the answer. And I'll say that on the question of getting vaccinated and the protection it offers you against long COVID, we're still learning a lot about this. There's new data coming out every week about what kinds of risk factors exist for long COVID and how we can protect ourselves and each other from long COVID. I'm going to say tentatively, based upon what I've read and understand, that the answer is yes, getting vaccinated does offer some protection, but we still have a lot we're going to learn about long COVID and exactly what it is and how it works and how we should respond to it. One of the things that has come out really consistently in the evidence is that it does seem like someone's risk of getting long COVID is related to how severe their infection was with COVID when they had COVID. People who had more severe illness seem to be at greater risk of having those post-acute consequences of COVID-19. And so if that's the case, and it does seem to be the case, the question I ask is, well, what can we do to reduce the risk of someone getting more severe COVID-19? And on that question, the data is very clear and very consistent that getting vaccinated does reduce your risk of getting severe COVID-19, reduces your risk of going to hospital, reduces your risk of dying of COVID-19. And even though we've talked about the fact that the vaccine protection wanes, while it does seem to wane against protecting you from illness, the protection against severe illness does seem to be really, really durable. Nothing's perfect, but it does seem to last quite a long time. And so it is really important to get that set of vaccine doses that you're eligible for, to give you that protection no matter when you experience COVID, because you're going to have some of that protection against severe illness. So getting vaccinated with all the doses recommended for you remains the most important thing you can do to protect yourself from long COVID. On the question of when I should get the vaccine dose I'm due for if I had COVID, right now our experts are saying that if you had COVID, it is best to wait about 3 months from when you had it to get a booster shot if you're due for a booster. The reason for that is because we have reason to believe that if you have COVID, that kicks your immune system into gear, and you're going to have some degree of short-term protection against being reinfected, and your immune system is going to be active as a consequence of fighting off that COVID-19 infection. And it makes sense to wait a little bit of time to get your vaccine, just so you can make the most of that dose. So that if you wait a little bit longer, you can get more benefit, more impact from that vaccine dose compared to if you got it right away after infection. You certainly can get it right away, and it will still give you some protection, but it seems like if you wait a little bit longer, about 3 months, you get the best bang for your buck.
I add to that, Marva. To post a really good document that I received today, because it is really confusing. If I'm this old and I've had this many vaccines, and the last one was at this time, when do I get my next vaccine, and who's eligible for a fourth, and when do younger people get a second or a third, and when do I get it after I've had COVID? It's really complicated. So there was a really good document that was sent out today that I'll try to post that covers all that information and is easy to refer to.
Okay, that's great. So look out on Emory's Facebook and you have that information. Thank you both. Kathy, I think, wants to answer this live. I'm going to click done and see if Kathy is available. I don't know how we boost her, but Megan is in the background. Thank you, Megan. To see if we can get Kathy on. If we can't, then I'll ask the question and we won't answer it live. Okay, I have asked. Oh, we might have to get back to that. Sorry about that. Maybe we can drop that in the chat. But let's move on to another question. And Marie, you answered the last one. I'll put this one to you as well. Is there any more information about the vaccines affecting menstrual cycles?
You know what? I haven't read anything about that recently. There was definitely information after the first 2 waves. There seemed to be a link between the original COVID and the next variant, the next 2 variants, between getting COVID-19 and having an interruption in menstrual cycles from COVID-19. But I haven't read anything recently on that. Matt, have you read anything on that?
I haven't recently, except to say that I've read previously different case reports. People certainly experience changes to their menstrual cycles after getting vaccinated. And to some extent, you expect that when you have so many vaccine doses going into arms, you're going to have some of these things that happen following vaccination, whether or not they're caused by the vaccine. I think, we may not have a clear answer to whether there's any connection between getting the vaccine and getting those changes, but I'm not sure whether or not those changes would ultimately impact the recommendation to get vaccinated. I still think that it is important to get vaccinated because it offers you good protection against the infection, and that's going to last for some time, especially against severe illness.
What I did read when I read it last was that there was a connection, more of a connection between actually having COVID and having a change in your cycles after that, than there was a link between vaccines and having changes to the menstrual cycle.
Okay, thank you. Another question, have BA.4 and BA.5 been detected in Canada?
I might have to take that one, Marva. So this is a really important question. As we see other parts of the world, they're seeing these new variants. These are also sort of sub-lineages, different cousins and relatives of the Omicron that we've been experiencing recently. And we actually get in public health, we get regular updates from our Public Health Ontario lab, which tells us what kinds of variants are we seeing in Ontario for every week that we get updates on. And so far, we haven't seen these variants showing up in the data that we get from Public Health Ontario, but we're watching that very closely. And I think it's reasonable to expect that because these variants are circulating elsewhere in the world, we will eventually see them when they end up in Canada. We know, of course, one thing that's been consistent to date is a variant somewhere else always gets here eventually because it has some advantage in terms of its ability to spread.
Right.
So we will potentially see it here in the future. And that's why we need to think ahead and be ready for that, and not let our guards down when it comes to those basic measures we've been following to date that work against current Omicron or future Omicron or other variants we may see down the road.
I think also those two variants are very prominent in South Africa and believed to be driving a surge in cases there. But the good news that I read today was that these variants were breaking through vaccines and even natural infections. So people are getting reinfected who've already had Omicron, but not with serious illness in people who've been vaccinated. So that's good news. And I think it's part of what we need to expect moving forward, that we're going to see these variants washing through our community every year, just like the flu does. And that vaccination is the key to staying away from serious illness.
Thank you. As someone asked us, should we wait till the fall to get the 4th booster? I think the answer to that would be no, right? The short answer.
I would say that. I would say if you're due and eligible for a booster now, get it now. And if there's a vaccine to offer you in the fall, get that vaccine in the fall when it's available. I know there's still some work happening to look at, are there Omicron specific versions of the vaccine? Are there going to be vaccines that contain multiple variants, protection inside them? We may have new or different things to offer this fall that are going to be preparing us for what we might face this winter. And we'll hopefully have more to say on that as we know what's going to be offered. But if you're due for a dose now, certainly get it now and don't wait.
And I'll add to that, Matthew, that please, if you're over 60, consider getting that 4th dose, because as we all know now, our immune system does not function as well after the age of 50 and even less after the age of 60. So that 4th dose, there is evidence that it does reduce the risk of getting infection, but not as much as it reduces the risk of getting serious infection and requiring hospitalization. So please, if you're over 60, get that 4th dose.
Great. A couple more questions in the same or similar vein. Someone says, when getting the 2nd booster, is it advisable to get Moderna or Pfizer if all previous shots have been Pfizer? And I'm going to add another one to this. A close friend of mine ended up hospitalized for almost a week with pancreatitis following a bout of COVID. She has none of the known causes of pancreatitis. Are you seeing any correlation between pancreatitis and COVID?
I haven't read about that, no. And I haven't seen an increase. I have a small, my practice is not large enough to be able to say if there is a connection. Have you seen that, Matt? Pancreatitis.
Yeah, I haven't seen data about that connection. However, what we have learned with COVID is that COVID, of course, we think of it causing a sore throat and lung infections, but it can have impacts in other parts of the body. And so it is certainly plausible it could be linked to pancreatitis. I just haven't seen that data myself.
Mm-hmm.
Helen, I'm going to double up on this question for you. And they're both about masks. Early in the pandemic, mask wearing was seen as a way of caring for both ourselves and others. It was like a public way of showing respect for one another. What suggestions do you have for re-envisioning wearing masks now that they are optional in most settings? And the next question, which is tied to that, I think there's 3 altogether. I find that more and more people aren't embracing the common sense preventions of masking, physical distancing, hand washing, etc. Omicron hits anyone, so more people think vaccines don't work. I have unvaccinated friends and family who won't get boosters. Interacting with others is getting harder, not easier for me, and stressful. And someone says, am I safe when I'm the only one or one of few wearing a mask in a room? I'll start with you, Helen, and then we'll go around the room.
Yeah, so I think, again, this comes back to tolerance and acceptance of our own level of comfort. When it comes to masking, even though the mask requirement has been lifted in our community, generally speaking, it still exists within healthcare settings and high-risk settings. Everyone's comfort level is going to be different. There are some people that are going to continue to wear masks for a very long time. And there are other people that have thrown out every mask that they've ever had. They'll never wear one again. And then everybody in between. And we just need to really give each other a lot of room and a lot of tolerance that that is okay. There are reasons why people are wanting to hang on to those masks. They could be for their own mental health. They feel safer, mentally with a mask. It could be because they're immunocompromised. It could be because they're getting cancer treatments. We don't know any of that. So we don't want to assume. We want to give people a lot of room and a lot of latitude. It's the same for people that are not wearing masks. It is their right now not to wear a mask because there is not a mandate. Now, of course, if they come into our offices at CMHA, if they go into a hospital, if they go into a primary care setting, they're going to have to wear a mask because that is the rule. So it really is about respect and tolerance and understanding and not making assumptions. And I think that's the most important thing right now for all of us where we're at, because the landscape is quite different.
Thanks, Helen. We have so many questions here. I'm just going to keep going if that's okay, but sharing one quick mask ditty that I saw on the GO Transit. And I'm borrowing it, and I'm going to paraphrase and make it a little funnier than on Go. But what it said is, now you can sleep with your mouth wide open. And so tomorrow night, when we have, not tomorrow night, Friday night, we have our event at River Run Center, and we know that city facilities, you don't have to wear a mask. Masking is optional. We're encouraging everyone to wear a mask, please. And we will have masks there to give to individuals who show up for the event. And so I am going to be saying from the stage, if you decide that you're going to nod off when one of our presenters are presenting and you are wearing a mask, feel free to keep your mouth open. We got you covered. That's what I'm going to use to encourage people to wear masks. So there could be some creative things, maybe around our city, or maybe public health will run a competition. So the most interesting encouragement that that one can write for people to wear masks. Maybe in schools they can come up with that for primary school or grade school or whatever. Might be interesting. So very quickly, I'm just going to run down some of these, and some of these are repetitive, but someone wants to know, what is wastewater testing in 30 seconds, Matthew, or less?
So essentially, whenever you flush a toilet or run water down the sink, that water goes into the sewer system, and we can actually measure COVID-19 in that water. And the idea is that gives us some indication of how many people in our community have COVID, because they're going to be shedding that virus down the toilet drain, and we can measure it there.
Very good. That's less than 30 seconds. Someone says here, I find that more and more people aren't embracing the common sense prevention of masking. We've already talked about that. They talk about feeling stress, and I think Helen covered that quite well. Someone says, I work 8 hours a day indoors with no windows for ventilation in a prolonged area. And since the mask mandate has been lifted, nobody's wearing a mask. And so this person is quite frustrated with that. Is there anything else I can do to protect myself physically from COVID and mentally from the stress, anxiety of what feels like an unsafe environment and the disconnect with people who no longer see the need for safety precautions? And I think, Helen, you answered that quite well. Hopefully this person was listening. Someone asked about reusing masks, and I heard, I think it was one of the provincial doctors talked about that you can leave a mask out for 10 days, the KN95 masks or the N95 masks for 10 days or so. And after 10 days, they can be reusable. I hadn't heard that before. This person is asked about reusing N95, KN95 or CA-N95 masks. Does anyone hear of reusing masks?
Yeah, so what the reading I've done has suggested that you can actually reuse a mask if you're just using it to head into a grocery store, and it's on for a very limited amount of time in a day, and it does not get wet while you're wearing it, that you can reuse it for up to a month. I haven't heard that you need to leave it out somewhere. Early on in the pandemic, we were actually putting our N95 masks into a Ziploc bag overnight and leaving it in the sun in the hopes that if there was any residual virus on the surface, that we could reuse it in 7 days time or so. But I'm not sure that that's really necessary. If you're wearing the mask for 8 hours a day, that's a bit of a different story. If you're in the healthcare system, you may not want to reuse that mask too often. But I know that our healthcare workers and the family health team have been given masks and suggested that they wear one for up to a week if it doesn't get soiled.
Thank you, Anne-Marie. And Helen, what are some low cost, no cost strategies to work on building that empathy muscle that we talked about? Hopefully we've answered a lot of the mass questions that were here.
Yeah, actually, there are a lot of things that you can do to cultivate empathy. First of all, talk to people, but actually really talk to people, not just about the weather, not just about, the Leaf game last night, but actually just talk about how they're really doing, and really talk to listen and understand. Trying something new is also very helpful because it gets you out of that comfort zone. And it gives you that anxiety, that worry, that stress, even if it's positive stress. And that's something very important to embrace. This is an interesting one that people may not realize. Reading fiction is actually a great way to build empathy because you dive into a character and you really live through that character's thoughts and feelings and their point of view. And it's really an interesting way to change the way you're thinking about things as well. Teaching your kids early and often about empathy. So it becomes that skill. If we talk to our kids about eating well and sleeping well and exercising and doing their homework, empathy becomes part of those daily lessons. And then the last thing is just monitoring your own cup. How full is it? And certainly being present and paying attention to your own level of stress is so important as we support others. So mindfulness, meditation, everything that you can do to stay grounded, of course, will only make you more available, present, and understanding with other people as well.
Thank you. And Sandra, listen very carefully to your advice on empathy. And she says, how am I supposed to have empathy for someone who chooses not to wear a mask, which in turns put my own health at risk? This person is immunocompromised. It's a tough one.
And it is tough because ultimately each of us has to keep ourselves safe, right? When think about the airplane, right? And the plane goes into trouble and that oxygen mask drops down, you have to put oxygen mask on yourself first before you can take care of anyone else. So if you're immunocompromised, you have to continue to do the things to protect yourself. And that may mean setting some really tough boundaries with people you love, people you care about, and people that you want to see, and having those conversations to make sure that you're safe. Nobody said this was going to be easy, that's for sure. And this is the space that we're in, that we're having to negotiate these conversations.
Yes, absolutely. I'm going to have final 3 questions as we go forward here. And someone says, I don't think the question about whether the person should get Moderna or Pfizer as a booster was answered. I just got my 4th dose and was given half a dose of Moderna. Peterborough Public Health recommended half a dose because I'm under 70, and Moderna because they felt it was more effective against Omicron. Pfizer was given only if someone insisted, and it is given at full dose regardless of age. Lots of complexities in here. I think this is one that we could probably answer online. I'd have to read it over twice or put it in front of you.
But Matt has an tell by his face.
Do you have an answer, Matt?
Well, I mean, I think this just speaks to what Anne-Marie was saying earlier about there being these evolving recommendations, and they are quite complex. And really, when you go to the vaccine clinic, you'll get advice about what makes sense for you. But with Moderna, for example, if you're getting a booster, it is typically a half dose, whereas Pfizer is typically a full dose, just because that's the way the science has evolved on these vaccines. In terms of Moderna versus Pfizer, there isn't really a big enough difference that I would say you should pin your hopes on one versus the other. There is some data that says in some contexts, maybe Moderna gives you a different kind of antibody response that could be a little higher. Whether that data on antibodies means a lot in terms of your actual protection is still up in the air. So I would say get whatever vaccine is available at the clinic you're at and get the vaccine sooner rather than later if you're eligible.
Yeah.
Okay, great answer. The person who had said that they were the only one in the crowd wearing a mask, are they safe if she's the only one, he or she's the only one wearing? And is just asking if this question could be answered.
I think if you're vaccinated, so that's the priority now, is to make sure you're fully vaccinated. And again, put that information up so people can understand who's eligible for which vaccine and when. And I think if you have an N95 mask on, if you're immunocompromised, that's the mask that I would choose. And they're now pretty widely available. There's not a, you can even buy them online at Staples. There are different quality masks in terms of the straps, but I digress. I think if you're wearing a well-fitting N95, that in fact you are protected from the other folks in the room that are not wearing a mask. And so that would be what I would do if I was concerned. That's actually what I do in public, grocery store, in the line at Tim Hortons, or if we're out at a restaurant, I put an N95.
Great. Thank you all so much. I think to wrap up, because we're wrapping up working to wrap up at 8:15 as we promised others, there was one question talking about if there's a test to show that someone has had COVID-19, if we can answer that question and then go to the final question. How are each of you finding balance in your daily life? And if that could be the wrap up and whatever message you want to add to that, to our community.
I'll answer the question about testing for COVID-19. There is an antibody test. It's not covered by the government. You can ask your doctor to put that on a normal Life Labs requisition form. It's not the be all and the end all because it's not necessarily accurate. So I tend not to recommend it to people, especially if they've been vaccinated, because the antibody test will be positive whether you've had natural infection or whether you've been vaccinated. There are other more detailed tests that look for the actual virus, but I don't think they're in the clinical setting. They're in the research setting.
Wonderful. Thank you. Now we're going to go backwards from Helen. How do you find the balance, Helen?
Well, I'm very fortunate at work. I have an amazing team around me that I rely on and I trust explicitly. And for me, that gives me the most amount of comfort in this minefield that we're navigating. And then at home, it's my husband and kids. I disconnect from work. I really try hard to not look at my phone and to recharge on weekends and things like that when I can, and spend some family time. So for me, it's those are the core basics. Good people at home, good people at work.
That's great. Matthew?
I guess I'm fortunate in that by having a 13-month-old at home, I have a person who will force me to think about things that aren't work or think about things that are a bit happier. And she certainly has been occupying my time. But the other thing I've been doing recently is thinking a lot about the things that brought me joy pre-pandemic. What did I enjoy doing? You know, for me, it's going on bike rides, it's taking out my camera and photographing nature. It's about going out and building something with my hands, and really trying to build time in my life for those activities where I can, because we can always find time for some of those things. So have to think through what are the things that bring us joy and how do we be conscious about doing those things going forward.
Really awesome. Emery?
Well, I'll be honest, I'm not finding balance anymore. I still am practicing all the things that brought me balance before, but I'm not finding balance now. I'm hoping my garden changes that. I'm hoping some sunny days and getting my bike out changes that. What I've tried to do this past weekend is to read fiction instead of always reading books on medicine or politics or Ukraine or Eastern Europe. I'm not going to watch the news for the next week because I find it too upsetting. And I am starting to reach out and connect to people that I've been disconnected with, not necessarily because we have not been able to gather together, but because I am too tired at night to reach out to people that I love. So I am making an effort to reach out anyway, and I'm hoping that helps. But honestly, I do not have balance, and I'm not sure that in the profession I'm in at the present time, that balance is going to be easy to find in the short term or the long.
That is really tough, isn't it? It is, it is where we go. It makes it hard, but I know that you are working on it, and I know that we're all working on finding the balance. I am grateful for Megan, who's in the background that you don't see, and for Tracy, of course. And if anyone wishes to donate, you can donate to CMHA, or you can donate to Bracelet of Hope. Those are the two ways that this got started. I am finding the balance by this lecture this Friday. I'm going to give it a quick plug. The Guelph lecture on being at River Run Center with Naomi Klein in conversation with Chief Ninawa Huni Kui. He is going to be there to talk about the challenges that we have. We need to secure the rainforest in the Amazon, and his tribe is there working with others protecting the rainforest. So I find the balance by looking at certain things sometimes that even much bigger than me, with the job that he has going across the world, trying to secure our environment. And then this amazing Ontario Poet Laureate, I love spoken word. He's going to be treating us to spoken word. And then Digging Roots is an Indigenous band, and they are fabulous. And so I'm hoping, even though I'm working on this, I'm still trying to find the balance to just hang out with these guys. It's like my nonfiction or my fiction, Helen. It's like reading fiction. That's what this is for me, listening to it and connecting with other people, as Anne-Marie has said. And of course, my 3-year-old granddaughter. I have a touch of everything, Matthew. With your 13-month-old, I think about my little Cassia and other little grands who helped me find the balance. So we thank you so much, all of you, for what you have shared tonight. As always, I know that our community is supported by the way you approach these questions, the honesty, the compassion, the empathy, and the care that you give into finding the COVID balance. It's difficult right now. And when you see that Anne-Marie is feeling a little despondent, you know that there's some work to be done. And Anne-Marie, there are some messages of hope you feel better, and we're sorry that you're not feeling so well today. So there's lots of love coming out to all of you and the work that you do. So thank you so very much. Please go to CMHA's website. Please go to Anne-Marie's Facebook. Please donate to Bracelet of Hope. We hope to see you another time. Please stay well. Wear your mask. Remember, when you wear a mask, you can do all kinds of things and people don't even notice. You can have lipstick on your teeth. You can have spinach on your teeth. You can have your mouth wide open. You can even drool. You don't even have to wear lipstick, for heaven's sake. And wearing that mask, it really does help, and it helps the person next to you, because we're all interconnected. So until next time, we will see you soon, and thank you for tuning in.